Hi, did you know that May was Mental Health Awareness Month? I'm Brianna Bryant. I'm the program coordinator for the Irvington Family Development Center. And my volunteer and community partnership specialist, Patricia Alcius, and I have joined together to ask mental health clinicians how to stay positive during the COVID-19 pandemic. Stay tuned.
What should people do if they begin to feel mentally drained in the house?
A number one suggestion is definitely to find different things that entertain you. It could be reading, if you have like an outdoor space that's safe, obviously, especially with the weather getting nicer, you can do different activities outside your home and not necessarily be out in the public. So if you like to read, you can read outside. You can play games outside if you have other people that are with you, like family members. Exercising is definitely helpful. Finding different things to do that are not necessarily in the house if that's what's causing a lot of your stress and confinement. You can also go out for walks, obviously in a safe environment. So if you feel inclined or comfortable, wearing PPEs, so face masks, gloves. You can go for walks around the block. The parks have recently opened. You can go for bike rides. I've seen a lot of people going for bike rides. I know a lot of people who are trying to find different ways to communicate with each other outside of internet connections. So people are riding around, meeting up with each other, but staying at a safe space and talking to one another, catching up on different activities. So there's always that too. So like I said, there's reading, there's going out for walks, exercising outside, kind of hanging out. If you have loved ones that you can hang out with, you can do that. But if you're not, if you're alone, you can find different things to do. There's meditation. There are, video exercises you can do. People are doing Zumba, they're doing Tai Chi. Mindfulness training is definitely online. You can do that as well.
What are some advice that we can give to people that are afraid to go outdoors in fear of catching the virus?
Like stated earlier, it can be very difficult, especially if you're suffering from anxieties, just simply going out and being afraid of what might happen if you go outside. Like I said earlier, it might be helpful to kind of like work your way out. You want to go outside, and if you haven't actually been outside of your own home, finding a safe space. So if it's, if you have a porch, if you have a stairwell, if you have like just a small front or even back of your house, just going out and exposing yourself to the sunlight, getting used to being outside and recognizing the spaces that you have. Not everyone has a lot of space in terms of like from their space to someone else's space, but finding what's comfortable for you. You can, slowly work your way up. So if you have the time and you have the ability, then you would work on, let's just say, going out to your porch or going out to, your front step, and staying there for a little while. And then after that, just kind of like increase the amount of time that you're out there and increasing the distance. And I'm not saying to go miles out, but just like walking, from one corner of your block to the next, no matter how small it is. My block is small, but doing that, or you can go around the block. That might be helpful. You can try different. If you are listening to music, you can listen to music while you're doing it to kind of make you feel comfortable. You can try different meditations. I like to listen to ambient sounds or nature sounds. So if that helps you, do that as well. That might be helpful.
During this pandemic, what can people do to stay active physically?
A great suggestion that I would give to people is definitely to make sure that you create some type of system for yourself. Stretching is definitely has been helpful to me. With every morning that I wake up, I normally wake up very early. I'm a morning person, and the moment I wake up, I stretch. I'm just kind of like moving my body around, because like they say, you don't use it, you lose it. I would definitely suggest that when any type of exercising that you're doing, any type of physical activity that you're doing, that you're stretching your body and making sure that you have not just to increase your stamina, but also to make sure that there are no pains that you're experiencing prior to being physical actively. So you can do workouts like suggested before. You can do workouts at home. You can do them from, if you have access to the internet, which most people do, but not everyone does. But there's definitely YouTube videos galore. So many different workouts that you can do online. There are different exercises that are like learned online or taught online. You can also kind of go out and work out. I've seen a lot of people working out in front of their homes. You can also go to, walk around, do some cardio. That's always helpful. Even if just for 5 minutes, 10 minutes, it definitely helps. Like on a nice day, like a sunny day, it definitely helps kind of like increase your ability to do activities on a regular basis. So it's definitely helpful. But pace yourself just as with everything else. You want to make sure you pace yourself, not just running out and doing everything and anything that you can do.
What is a good breathing technique that I can use to relax during this pandemic?
I personally love deep breathing exercises. I love them because it helps you to decrease stress and it helps you to relax your body naturally. One breathing exercise that I use often is the 8-4-7 method. You exhale for 8 seconds, breathe in for 4 seconds, hold that breath for 7 seconds, and then exhale again for 8 seconds. You can repeat this as many times as you need to create that state of relaxation that's comfortable for you. I would also suggest using YouTube. YouTube has guided meditation videos that can help you to relax also. You can type in guided meditation for anxiety or deep breathing exercises for depression, whatever it is that you're feeling that you want to just get some relief from or just get some breathing exercises for, you can type in and it'll help you.
What are some things that I can do to prevent depression during this time?
So when we think of depression, we think about people moping around all day or sleeping all day, being unable to get out of bed, maybe overeating or undereating. And although those things can be symptoms of depression, it can also look like going to work every day and following through your normal routine, all while feeling empty or feeling lonely or irritable. So those things can be symptoms of depression too. So I would say to maintain a calm and stable mood during this time, honestly, would be to eat good food. I always say food and mood go together. When you eat carbs, it really brings you down, make you feel like you're lagging all day, and it doesn't give you the energy that you need to make decisions or just be present. So the first thing I would say is food and mood. Get some fruits and vegetables in your system, in your body. It really will change how you feel. Also, I know people hate to do it, like me, but exercising. Exercising naturally releases endorphins, and endorphins really help us get the serotonin, the dopamine, all those good neurotransmitters that make us feel good. So I would say to maintain a stable mood during this pandemic would be to eat good and exercise, and lastly, sleep routine. If you can develop a great sleep routine, meaning you go to bed every night at the same time and wake up every day at the same time, just like creating a routine for yourself, it will help you with a better mood because the lack of sleep is also a symptom of depression.
What should I do during this time if I begin to feel overwhelmed?
If you are feeling overwhelmed as a mom, one thing I would suggest doing is finding time for yourself. Now, I'm aware that that's not always possible. So if you have support within your home, I would suggest maybe taking a bath or a hot shower, maybe lighting a candle or calling someone who you love to talk to just to help you feel more balanced and less stressed and overwhelmed. If your children are with you all day and you unfortunately don't have someone who can balance or offset some of that time for yourself, maybe you can use your senses. That's something I like to do. I like to light candles so I'm smelling something. What's something that I can taste? Things that are surrounding me. What are things that I see right now? And allowing those things to help you stay in the moment. I think also a part of feeling overwhelmed right now for the moms that I've been speaking to is the fact of balancing both your work and balancing your child's schoolwork. So I would say create a routine. Yes, we're home during this time, but maybe you'll create a routine that helps you stay on task, stay on track. In the morning, we wake up at this time, and then we take our shower, and then we eat our breakfast. We do schoolwork at this time. Mommy does her work at that time. Just creating a routine that'll help both you and your child feel less overwhelmed and feel more productive even during this time. And lastly, keep in mind that for children, this is overwhelming too. They're not used to being home all day. They're not used to being confined in their homes all day. They're used to seeing their friends and their teachers and different scenery. So just being patient with them and being patient with yourself.
What are some in-home advice that we can give to married couples while staying home together?
Advice that I can give to married couples right now is to continue to have date nights. During these times, it is important that you set aside time just for you and your partner. So one of the ways that you can do that is to have a movie night. With your movie night, you can pop some popcorn, watch your favorite movie, enjoy some snacks, and just enjoy that time together. Another way that you can do it is to have a date night. You can cook your favorite dish, get dressed up, set a date, meet each other in the kitchen. And even if you don't want to cook, you can have a lot of restaurants are offering takeout, so you can have your food delivered to you and just have that intimate time. You know, get out of the rut, get dressed up, and just spend intimate time together. So one thing is just to prioritize intimate time. Right now, a lot of parents are now also school teachers, so just make sure that during that time, it could be just to get a glass of wine or just to have intimate moments when the kids are away or you put the kids to bed. Just make sure that you guys have intimate time together by being creative, by having date night ideas, movie nights, your favorite takeout dish. Just make sure that you're spending time together. Even switching it up and getting dressed up, all those things would be able to help you sustain a good relationship and keep the spice and the intimacy alive.
What is something we can all do as a team to prevent the suicidal rate during and after this pandemic?
Something that you can do as a team in order to prevent suicide before and after the pandemic is definitely provide support services that are needed. There are people that were suffering from mental health services before the pandemic, and now there are a new population of people because of the pandemic who become more anxious, who become depressed, who have had life circumstances such as grief and loss of a loved one, of friends, a job. So there are definitely heightened anxiety levels, heightened depression, and a new population of people that need the mental health services. So one thing is just to provide the support and the services for people that need them. So if someone is feeling anxious or someone is feeling depressed as a client of yours, make sure that you're checking in, make sure that you're reaching out and giving those people the support that they need at this time, before and after. So right now, there are still practices that are doing services via teletherapy. So you can still receive services, you can still receive counseling if you need them. And even after this pandemic is over, continue to reach out to mental health professionals in order to get those services that you need. So right now, the most things that I believe that can prevent or decrease the number of suicide rates is to provide support and also services for clients that are in need at this time, and to properly identify them as well.
What are you expecting to hear or see from your clients when returning back to work?
Some things that I'm expecting to be different now with the practice or my students that I see is that coming back, they may have a heightened level of anxiety, a heightened level of depression. If they already had those pre-existing conditions, this pandemic may make it worse because they may be experiencing things like loss. They may be experiencing things like grief, missing school, missing their friends. And for some seniors who missed out on a lot of activities as far as graduation, prom, and all those end of the year activities, they may feel a level of sadness. And for some who may already have school anxiety, coming back to a building with hundreds of students may be on high alert for them because they are thinking about getting the virus or contracting the virus. So you may see some school refusal. Some students have gotten used to being home and don't want to come back to school. So basically, I expect to see a heightened level of anxiety, maybe sadness and depression about what's going on right now.
Closing remarks. To wrap everything together, what is one more thing that you would like to share with everyone that will be viewing this video? It can be about maintaining anxiety, stress, depression, physical and mental health, etc. during this time.
So, closing remarks that I have is just to know that you are not in this alone and that there are still services. If you are feeling depressed, if you are feeling very anxious, if you are feeling at a loss, you may have experienced some type of grief, a loss of your job, or just feeling anxious about what is going on, just make sure that you reach out to someone. There are still telehealth services. So if you feel like you need to talk to someone, reach out to your family, reach out to your friends, and also mental health professionals. We are still here to help. It just may be through a different medium, like using FaceTime or using a kind of medium such as Zoom or Google Meet or what have you, but we are still available. There are still services for you. So don't think that because we are going through this pandemic that you have to suffer alone. Just make sure that you reach out to a mental health professional. Go on Google, research and see what type of profession that you may need, and you can be able to get some services there. Also, just make sure that you are doing things that you love. Practice self-care. Some people have picked up a hobby or interest. Do things that you like to do. Try to get your mind off of things. Use techniques such as mindfulness, prayer, meditation, yoga, breathing exercises, music, whatever that you do to calm yourself down when you are feeling anxious. Use those things and just stay connected to people. Reach out to family, reach out to friends, check on loved ones. And we can get through this, and we will get through this together. So just make sure that you keep that in mind.
One thing that I would like to say, and this, I probably should have said it in the beginning, but definitely recognizing what you can and cannot do, recognizing your strengths and your weaknesses, not just for you to know like what you're capable of doing, but also knowing when too much is too much. What people don't understand is that anxiety and stress is a real thing. It's a real condition that people suffer from on a day-to-day basis. This is not just after quarantine. This is even before. And knowing your symptoms and the triggers that you experience are definitely important, because a lot of people that I meet with on a regular basis, some of them don't know what their triggers are, and it's not until they kind of talk about it in therapy where it's like, oh, I didn't realize that that's what was happening. I didn't realize that I was struggling. I didn't even realize I was going through anxiety in that moment. So being everyone, we all know ourselves, and unfortunately, there are some symptoms and triggers that happen for us that we don't recognize it until it may or may not be too late. So if you're having a hard time, let's just say breathing, you're having a hard time concentrating on things, especially now, you don't enjoy the things that you used to enjoy, you're finding yourself tired for long periods of time, you're finding yourself down and out, struggling with either depression, anxiety, just low points. These are all symptoms that you want to be mindful of. You want to make sure that you take care of them and you tend to them. And that doesn't necessarily have to mean going to see someone or going to talk to a therapist. It could just be whatever works for you. Some people find it helpful to pray. Sometimes people find it helpful to seek out help from their friends and loved ones and just wanting to get back out into the world of communication, face-to-face communication even. Whatever works for you, listening to music, listening to relaxation sounds. Some people are just tired and need to sleep. And you can do that, but you know that if you're sleeping for longer periods of time, more time than you have been for a long period of time, so more than 2 weeks, 3 weeks, even 4 weeks, you definitely want to make sure you take care of that. And lastly, I want to make sure that everyone is fully aware that you can do this. You've got this.
As I'm ending these questions, I just want to say it is okay not to be okay. COVID-19 is something that none of us have ever experienced in our lives. We've never experienced a pandemic where everything's shut down, even schools. So if you're feeling overwhelmed, if you're feeling anxious, if you're feeling unproductive, that is okay. However, if those feelings are just taking a toll on you and making you feel like you just don't know who you are or you're not doing well emotionally, it is okay to ask for help. Perhaps you can call a therapist, a friend, a spiritual advisor, a spiritual director, whomever you lean on for support.